Your body is telling you just need to take it easy. And that doesn't mean doing nothing, because I think moving your body is healthy. It's good for mental health, physical health, but you might just want to modify. So low impact things, yoga, gentle walking is great. Light jogging is probably okay, but you really might not feel like it. And so it's finding that balance. Welcome to Baby or Bust. I'm your host, Dr. Lora Shahine, and I am tired of infertility and miscarriage being misunderstood, hidden, and full of stigma. Welcome to the podcast with interviews and in-depth discussions on topics all things reproductive health. Thank you to our friends at Seattle Sperm Bank and Braze Runs Production for sponsoring the show. Please take a moment to give us a 5-star review anywhere you listen to your podcast. It really helps people find the podcast. Patients can get so confused about different recommendations for exercise while trying to conceive, during IVF treatment, and early pregnancy. We can get paralyzed by worry about doing something wrong, so that we eliminate exercise, which is actually a terrible idea because movement is essential to physical strength, hormone balance, mental health, and more. It may be important to modify your routine, especially during ovarian stimulation with egg freezing and IVF. But let's review the evidence before you stop doing something that you enjoy out of fear of doing something wrong. How much can I exercise during IVF? It's a very common question. Exercise is important. It is a part of your physical and mental health. But so often people are told, if you're doing IVF, stop exercising completely. And I actually don't think that that's right. That's not what I tell my patients. Of course, you need to talk to your doctor about your personal situation. But let me explain a little bit more about fitness and fertility and IVF. There's got to be a balance. A sedentary lifestyle, no matter what weight you are, if you're not moving your body, that's associated with infertility. And if you have too much strenuous exercise, if you're really pushing your body to exhaustion, that's not ideal for your reproductive health and fertility as well. There's got to be somewhere in between. And patients get stuck in the middle of trying to understand what is best for them. So let's talk about it. So when a patient asks me, well, how much exercise is too much? I want to look at the data. So there's one study published in 2006 in the journal Obstetrics and Gynecology, looking at over 2,000 women in the Boston area that were reporting on exercise routines in the few years leading up to their IVF cycle. And in this one study, it did show regular exercise did not impact outcomes of IVF, but women who reported routinely more than 4 hours of vigorous exercise in a week leading up to their IVF cycle had a 40% lower success rate with their treatment. So that's pretty alarming. I started counting up how much I exercise, and I just don't think it's that black and white. Because I think every person is different, every body is different, and certainly types of exercise are going to be different. So we do know from other studies, pushing your body to exhaustion, like real vigorous exercise, can shift our body to a more fight or flight kind of stress hormone, cortisol releasing state and away from reproduction. So I don't want to tell everyone out there who's trying to conceive, don't exercise more than 4 hours a week, because that's just too black and white. But I think that you could move your body, be healthy, but maybe when you're trying to conceive, and certainly when you're in your IVF cycle, you want to modify. So what about during the IVF cycle? Why do people say don't exercise? In an IVF cycle, the reason sometimes people are told not to exercise at all is that your body is working hard on recruiting all those eggs, and there is a small risk of something called ovarian torsion. Let me explain. So in an IVF cycle, you are recruiting more eggs than you would naturally ovulate without these shots or gonadotropins. And so if you are ovulating 10, 20 eggs, then your ovaries are going to be enlarged and working hard with developing and maturing those eggs inside little pockets of fluid called follicles. When your ovaries are enlarged, they're at a slightly higher risk of torsing on themselves. So the ovaries are actually attached to the sidewall of the abdomen and the uterus with little ligaments. And if the ovary twists on itself, then it can cut off blood supply to the ovary, and it can be very painful, and it can be a medical emergency. It can require a laparoscopic surgery to untwist the ovary. This is really, really rare. This happens in 0.03% of IVF cycles. I looked that up. And so it's something to talk about. And you are at higher risk of ovarian torsion when you are stimulating the ovaries and they are enlarged if you do vigorous exercise. So I do talk to my patients about, as you get closer to your egg retrieval, it's okay to be swimming, but let's not do flip turns at the end of the pool, right? Because you're twisting yourself. Yoga is wonderful. Stretching and moving your body is wonderful, but let's not do crazy high impact yoga, and let's not do inversions, crow and handstands and things like that. Let's move our body and get the benefits of yoga, but let's not do the inversions or where you're flipping up. So even like downward dog, I think I would just avoid that close to your egg retrieval. And one of the biggest side effects of doing an IVF cycle is just feeling bloated and being tired. Your body is working hard. There's so much mental energy that's going into remembering your appointments at the clinic and remembering your shots every day. Sometimes my patients are like, I'm usually a night owl, and the last week I've wanted to go to bed at 7 p.m. So your body is telling you just need to take it easy. And that doesn't mean doing nothing, because I think moving your body is healthy. It's good for mental health, physical health, but you might just want to modify. So low impact things, yoga, gentle walking is great. Light jogging is probably okay, but you really might not feel like it. And so it's finding that balance. So let's recap. Exercise is important for your mental and physical health, but when you are trying to conceive, and certainly during your IVF cycle, you want to modify. There is a very small chance, but real chance of ovarian torsion around the time of your egg retrieval, when your ovaries are enlarged and recruiting multiple eggs. So that is why sometimes people are told to not exercise at all. I think it's okay to move your body a little bit. Of course, talk to your doctor about your specific situation. But I tell my patients to not completely cut out moving their body, but think about modifying, not pushing yourself to exhaustion, and not doing certain types of exercises that increase the risk of torsion, twisting, standing on your head, flip turns in a pool, that sort of a thing. For the fertility story this week, I want to share a certain patient, but I've had lots of patients just like this in my practice over the years. When I asked Sally about exercise, she started with, quote, "I love running and cross training." And I asked her to clarify, because it's important to get details when you're asking questions, because running and cross training can mean very different things to very different people. Some people that could be a jog every once in a while, but Sally told me that she ran at least 5 to 10 miles every single morning and had a long run on the weekends, which could be up to 20 to 25 miles. Plus, cross training for her could be weights in the afternoon or swim or hot yoga. So she was working out twice a day and really extended workouts on the weekend. Her regimen reminded me of how much I worked when I was playing Division I field hockey in college. That training schedule was intense, and it's why I had to eventually decide between being pre-med or field hockey, and I think you know what I chose. But I loved hearing this dedication and passion from Sally. She loved doing triathlons and Ironman or Ironwoman races and marathons. She loved competing, and I love that she had that interest. But when I talked to her about exercise and stress and cortisol levels and suggested modifying her exercise routine in order to optimize her hormonal balance, she panicked. She argued that she must be okay with what she was doing because she was still getting periods and her BMI was in a normal range. She had had years in her life, in her late high school and early college years, where she was training so hard that she actually stopped having periods completely and learned about this Female Athlete Triad. This is a constellation of 3 clinical entities. Number 1, menstrual dysfunction. Number 2, low energy availability. So that's with or without an eating disorder, like over exercising or under eating. And number 3, decreased bone mineral density, because you're not making enough estrogen because you're not ovulating, and estrogen helps with your bone health. And this Female Athlete Triad was first coined by the American College of Sports Medicine in 1992, but its utility and diagnosis and usefulness and evaluation and treatment has really been debated over the years. Her doctor then told her that she had the diagnosis, but as long as her BMI was between 18 and 24, and that she was menstruating, that she was fine and she could work out as much as she wanted. Her exercise was her pressure valve release, her coping mechanism. The endorphin rush that she got with an intense workout and running had become her drug of choice. It was a really tough discussion because she felt like I was taking away this thing that she loved and this coping strategy that she had. But we talked through modifying her routine in order to decrease the amount of stress on her body. And I encouraged her not to eliminate exercise, modify, but also find other outlets for her stress. Because this is such a good reminder that too much of anything is actually not a good thing. Sally is the opposite of some of my other patients that eliminate exercise altogether after ovulation and during the 2-week wait before they know if they're pregnant or not, because they're worried about the embryo getting dislodged and impacting implantation. But being completely sedentary isn't good either. So I really encourage balance, and I strongly encourage people to talk through their routine, what they enjoy, and how they can modify with their doctor so that you can find the right balance for you. I hope you enjoyed this deep dive into exercise and appreciate how confusing this topic can be. I hope you take what you learned today, talk to your doctor about your personal situation, and find the right balance of exercise and movement that is right for you. Find this episode and all others at my website, drlorashahine.com. I love educating. You can find links there to my YouTube channel, Instagram, TikTok, and send us an email to hello@drlorashahine.com. Share your own fertility story and topics that you'd like to learn about, people you'd like us to interview. Thank you to my producer, Shannon Perry, and her team at Audiotocracy. This is your host, Dr. Lora Shahine, and I'll see you next week where I share a wonderful interview with Adelaide White, a fertility advocate that you've probably seen on TikTok. Until then, wishing you love, luck, and pineapples.